Good evening, guys. I've got discussion B for you. We're discussing American Affordable Act. Okay, so that is B's discussion tonight. Here we go. Main points in depth. What's happening? The page highlights a looming shift in U.S. healthcare access driven by two major policy changes. First, the Enhanced Subsidies for Affordable Care Act, ACA, marketplace plans, introduced under the American Rescue Plan Act for 2021, and later extended by the Inflation Reduction Act, are scheduled to expire at the end of 2025. These subsidies have been critical in lowering monthly premiums for millions of Americans. Second, states are actively rolling back Medicaid coverage following the end of the pandemic era. Continuous coverage requirement, which had temporarily prevented disenrollment. Together, these changes could reshape the landscape of affordable care, regaining debates about the balance between public health priorities and fiscal restraint. Immediate numbers and scale. Premium risk. Without the subsidies, analysts project that average ACA marketplace premiums could jump by 25 to 100%, a dramatic increase that would make coverage unaffordable for many households. Medicaid current in 2024 alone, more than 25 million people were disenrolled from Medicaid and the Children's Healthcare Insurance Program, CHIP, as states resumed eligibility checks. This represents one of the largest coverage losses in U.S. history within a single year. Who's most affected? Low and moderate income enrollees. These individuals depend on subsidies to keep premiums manageable. Losing them could force many to drop coverage. Recently disenrolled Medicaid recipients, millions who lost Medicaid, may not qualify for subsidies or may face gaps while navigating the marketplace. Safety net providers, hospitals, community clinics, and nonprofit health centers that serve uninsured or underinsured populations will likely see rising in uncompensated care burdens, straining already limited resources. Likely consequences for access to care: coverage erosion, a significant rise in uninsured rates is expected, particularly among vulnerable populations. Delayed or forgotten care, preventative services, chronic disease management, and routine checkups may be skipped due to cost barriers. Household financial strain. Families could face difficult trade-offs between healthcare and other give me 1 second, guys. Other essentials, such as premiums and out-of-pocket costs to climb. System stress. Emergency departments and community health clinics may experience surges in demand as uninsured patients often turn to these settings for care. State by state disparities. Outcomes will vary depending on local Medicaid policies, outreach efforts, and whether states expand or restrict eligibility. What to watch next? Congressional action. Whether lawmakers extend or replace the subsidies before their expiration will be pivotal. State Medicaid strategies, policies, and outreach campaigns aimed at reducing disenrollment or helping people transition to marketplace coverage will shape outcomes. Marketplace signals, premium filings, enrollment trends, and insurer participation will provide early evidence of how affordability and access are shifting. In essence, the page underscores a critical inflection points as subsidies expire and Medicaid rolls shrink. Millions could lose affordable coverage, reshaping the U.S. healthcare system and intensifying debates over equity, sustainability, and the role of government in ensuring access to care. Okay, guys, that's your B for tonight. And we'll see everybody in a bit for C. Give me a little bit for C, please. And I'll be back on with that for you shortly. For now, Gator Wellness, take care, folks.